Hi, my name's Steve. I'll be your nurse today, your male nurse. Okay, I'm going to go ahead and verify his armband. Okay, I know you're James Franklin. How you feeling today? What's your pain level? Check his pain level between 1 and 10. I'm going to wash my hands. I'm going to go ahead and wash my hands and glove up. Things I'm going to come in. So then I'm going to talk to the patient about
So what you're going to have is some sterile solution.
sorry.
Sterile cup.
So I'm going to talk to the patient about how his pain's feeling, how he's doing. We're telling him about the procedure we're about to do because
Your head's not in this, is that okay?
Yeah, that's fine.
Okay.
I'm waiting for the doctor's order. So, I received a doctor's order saying we got to change the dressing. So, I'm in gloves. I'm all gloved up. Checking his pain. Everything's checked. Let's get started. So I'm going to take a look. I'm going to pull off his goods here. I'm going to throw that in my hazmat bag. I'm going to pull all this out. Throw it in here. So now first thing I'm going to do is I'm going to measure this wound. I'm going to check for the undermining, any abnormalities, and I'm going to check the dressing for different, for discharges or blood, anything that might be negative. Smell. So then I'm going to come over here. I'm going to get one of my Q-tips. I got to measure the wound. So I got this little tape measure, okay. So first thing I'm going to do is I'm going to do this, okay? So we know this is about 14. I'm going to go ahead and discard it every time. So then I'm going to do the width, which is about 3, looks like. Then I'm going to discard it, do the depth. It's about 3. Yeah, looks good. So I'm going to discard that into my bio bag. Okay. I'm going to take my gloves off, wash my hands. I'm going to come over and set up my sterile field. As you can see, I pre-poured my water, but this is a brand new bottle. So what I would do is I'd open it up, pour it in there. If it wasn't new, I would go ahead and pour it and just go ahead and kind of cleanse the ring of it by turning it when I pour. So we're going to get rid of that. Okay, so now I'm going to set up my sterile field. I got my water. I'm going to tape my little Q-tips up here so it's nice and then I'm going to, this is ABD. First thing I'm going to do is get my ABD, my 2 4x4s, and my gloves. This is actually sealed so that I'm going to have to open it. So I'm going to go ahead and make sure not to cross all these areas. Of course, the table's not wet. So I'm going to go ahead and open this. I'm going to move it, making sure not to put my hand over the package there. Open this.
Try to give her a little privacy here.
Okay, so then this, I'm going to open this,
And I'm going to take off this dressing.
throw that out, I'm going to
Now I'm
open
going to
that.
start from the back forward.
Now, of course,
On the skin.
a brand new package, this is going to look a little bit different. It's going to be more like this. So this has been used before, but I'm not supposed to touch this area here. I'm going to go ahead and try and put it in this way, but I might have a couple of technical difficulties with this glove, but just bear with me. So basically, I'm going to put the glove on like I got to touch this, but the thing is, you're not supposed to touch any of this. It's supposed to be underneath because it's folded back. So you guys know what I'm doing. You're all
The glove size is probably too
You guys are all
small.
nurses watching this.
You probably need like an 8.5. That would
I
probably
need like I need like a 10. But basically, I'm not supposed to touch any of this glove that I'm doing now.
Now, I'm going to rewash and put on some and I'm going to go ahead and get some applications
Okay.
set up. And sterile.
Give me a glove from over there. So
The largest are over there.
here we
Those are
go.
the mediums. Pretend that's a
just gonna
sterile
pretend
glove.
This is a sterile glove right here. No, it's okay. I'm just gonna pretend this. I don't want to use your stuff.
Same size gloves.
So now I need
Yeah, but he's afraid of busting into it.
This will
And
be okay. I just
sterile solution. I'm going to check this
Okay.
for date.
I'm gonna do it again. Just keep rolling. So this is folded back. So I'm gonna touch
I'm going to have to
like this. You see?
I would have to drain off the top of it.
If
so
I can.
that there would be no contaminated function on the top. I'm gonna go ahead and pour my solution in. Close
I
that.
think large is too damn small.
Move it back here.
Jeez, Steve, what are you, an ogre?
Now I'm gonna.
All right, well, we got that
So I'm
on.
gonna process for measuring it.
Hey, we got that on. You know what I'm saying. We're gonna say it again. So this,
Now that, yeah.
I can only stay on the good stuff.
On the skin. I'm gonna go ahead and take my sterile applicator, dip it in my solution, and I'm gonna clean it from the
Well, this stuff is hard when you have man hands.
all the way down.
So then I'm gonna peel this
I'm
down.
gonna get rid of that, get a clean one, and dip it in. And then I'm
All right,
going
so
to,
that's good. See how I was underneath there? Flip it back, and then this
12,
actually would be flipped back like that.
Excellent, excellent.
remove that.
So
I'm gonna get
now I'm in
clean
a
one,
sterile environment.
and I'm
So
gonna
this is
go
what I'm gonna do. I'm gonna go ahead and clean the wound right now.
back.
So I'm gonna take one of my Q-tips here.
Now I'm gonna have to
I'm gonna dip this in the solution. And I'm gonna go from the front to the back.
I'm gonna
Discard.
glove
I'm gonna get another one. Dip it in the solution.
piping.
I'm gonna
And
go
now I'm gonna set up my
away from me like this. Discard. Grab another one. Dip it. I'm gonna go this way. Throw it away.
So I'm gonna take a new clean applicator.
So now I'm gonna get my gauze ready.
I'm gonna go
So I'm gonna get
the length,
this
and
one
I'm gonna
here.
measure,
Okay.
and that's 13.
Two
Get
of
rid
them.
of that, give me one.
So I'm gonna wad this up like this. I'm gonna dip it in here. Let it soak up the juices
And that's 3. Get rid of that.
without touching the water. Then I'm gonna wring it out.
And now I'm gonna measure the inside.
Now I'm gonna get a brand new Q-tip
When I
here.
find
Wait,
the
I'm
deepest
sorry.
point, I'm gonna measure.
Let me get this out like this.
And that's also 3
I'm
and a
gonna
half.
kind of spin it
Now,
in, spin it up a little
I will
bit.
be checking the undermining,
Okay.
so
So I'm gonna get a Q-tip.
got a new one.
Come over
I will
here.
be checking the sides of the wound to see if there's any tunneling or undermining going on. This lady is good. She has none of that. So I'm gonna go ahead now and set up my sterile.
Okay. So then I'm gonna get the next. I'm gonna discard this, but really I'm not. Let me get another one. Dip it in here.
And create my sterile.
Oops. Just that like that. Squeeze it off in there. Pull it out. And grab me another Q-tip. Put that in there. Go ahead, get me a new one in there. Looks good. Got that taken care of. I'm gonna discard this. So I'm gonna grab my two 4x4 gauze right here. Drop one. And I'm gonna take another one, drop it.
This one I'm gonna pull.
I'm gonna grab my ABD. Okay. So now I don't think I need to be sterile anymore. What I'm gonna do?
Nope, wound is covered.
I'm gonna cover the wound.
I'm gonna go ahead and take my other one. Bring it out. I'm gonna take my sterile applicator and I'm going to
I probably in real life would not probably be this hard, and I would put little tabs on the end. But for time's sake,
The fact no one wants to watch a 9-minute and
nobody wants to- I
9-second
know you're
video.
probably fast forwarding through this right now. And then I'm gonna take a little piece of tape and I'm gonna put my little date, my name, time. I'm gonna draw a little picture on there. What I'm gonna do is I'm good with this. What I'm gonna do is I'm gonna chart the patient's pain level. I'm gonna chart, what I found. I'm gonna chart. His pain. I'm gonna chart his pain level. Everything that I did in this procedure, I'm gonna chart it. So I mean, it's what I found in the bandage and the measurements of the wound, and pain level and how he's doing. So, and then I'm gonna give him a big hug, and I'm gonna lower the bed. I added that, giving him a hug.
Okay, that's good. That's
not
extra.
Really written. Okay.
We good?
Yeah.
And